Hi everyone, my name is Yuan Yuan. So today I'm going to talk about the TCM application for emergency situation. So the blockage of important blood vessels such as heart and brain is the #1 killer of humans, accounting for over 20%. Heart blockages, sometimes we're having, for example, myocardial infarctions, and the blockage of the brain blood vessels sometimes will bring us ischemic stroke, because you never know when it will happen. And the time for rescue is strictly required, so it just often catches people off guard. Each of us should understand this knowledge to ensure the safety of our family. In the face of such emergencies, the first thing to do is to call 911 for professional rescue. Try to keep the patient lying flat to ensure that the heart's blood is more easily supplies to the whole body organs and avoid excessive movement of the patients to cause secondary injuries. However, today I want to introduce to everyone a Chinese medicine first aid method. Doing it at home while waiting for rescue to arrive can help alleviate the patient's symptom and survive the crisis. So this method is bleeding at the fingertips. So first, why? Why prick your finger for blood? Why it can save lives, and does it really work? Before asking these questions, we must know that our body is a very precise system with self-regulation mechanism. For instance, when it is hot, our pores opens up, allowing us to sweat and to cool down. And when it's cold, our pores close, preventing heat from escaping and thereby keeping us warm. Another example is when we catch a cold, our body heats up, having a fever. Why? Because there are many white blood cells in our body acting like soldiers who can fight against the virus. To give this white blood cell soldier an advantage, our body automatically adjusts the temperature, which inhibits virus and allow the white blood cells to work more efficiently. None of these actions are controlled by our mind. They're all self-regulated. Please think about it. If our finger gets pricked, what would we feel? Severe pain, right? And typically, under what circumstance would our finger feel intense pain? Right, injury or when we were in danger. In these situations, the body would not only have to deal with the invasion of bacteria, but may also need excellent physical strength to allow us to run away or fight in a dangerous situations. So let's say what our smart body will do. First, cells in the area of pain will release some special substances such as histamine, which increase the local blood flow. However, if the local blood flow increases, won't other part of the body lack blood? How does our body ensure that other organs maintain smooth blood flow while dealing with dangerous external environment? Actually, the intense pain will activate the sympathetic nerves, leading to a spasm in peripheral blood vessels throughout the body. This results in increased blood pressures, providing sufficient blood supply to the organ in need. And the heart sometimes will beat faster, increasing the overall blood supply in the body as well. These measures are mainly to ensure the blood supply to the heart and brain. In the instant when the finger is pricked, the body will naturally react in this way immediately. It doesn't require your thinking, and just in the moment of the prick. These reactions will also cause the originally blocked brain vessels or heart vessels to be instantly opened a small gap. So the brain cells, heart muscle cells, which were originally about to die, are re-nourished. This buys the patient life-saving time and greatly reduces the occurrence of sequelae. We have this expression in China: 10 fingers are connected to the heart. This is because the fingers are the most sensitive part of the body, needling which will cause severe pain and let the heart start pumping harder immediately. And these acupoints on the fingers are called Jingwell points. Jingwell points in traditional Chinese medicine because although the well is on the surface of the ground and very small, it can draw water from the deepest part of the ground, just like the Jingwell points. They are far from the heart, but they can enhance the strength of the heart. Isn't it incredible? When can we do it to save lives? In case of myocardial infarctions or stroke, we can use this method for emergency rescuing. Can you recognize them? For example, for myocardial infarctions, you may notice that patients will have their hand pressed on the left chest and they will have painful expressions or maybe just verbal complaints saying, I have stuffy chest, I can no longer breathe, I have chest pain. Those are mostly myocardial infarctions signs and symptoms. And in case of stroke, you may notice the weaknesses on just one side of the body. For example, if the patient have right hand weaknesses, she or he may also have right leg weaknesses, facial drooping on the same side as well. Meantime, the patient may have unclear speech and cognitive impairment. But don't worry too much, even if you cannot distinguish or recognize these two situations, because even you did it without these two situations, it is harmless. Don't worry too much. But when the patient is unconscious, make sure there is still a heartbeat, because if there's no heartbeat, the number one measure should be CPR, cardiopulmonary resuscitations. So if there's no heartbeat, this won't work at all. First, prepare clean tissues, alcohol swabs, and lancet. It is best to have disposal gloves to protect yourself, right? We are prepared. Which finger do we usually start with? It is the middle finger. Why? Because the middle finger is directly connected or related with the heart blood supply through the pericardium meridian. And stimulating the middle finger, of course, will have a more direct effect on the heart. So start with the middle finger first, and the middle finger can be pricked a few more times as well. Squeeze out 5 to 10 drops of blood. And other fingers can also be pricked. To save time, we sometimes usually grab all 5 fingers on one hand and prick quickly and bleed quickly. And if there's no improvement, toes can be also pricked. And when we do toes, we normally start with the big toe, which is connected to the head. So then you will usually see the patient return to normal within a few minutes. Some frequently asked questions: can this method, which is bloodletting, treat myocardial infarctions and cerebral infarctions? The answer is unfortunately no. Bloodletting is just an emergency rescuing method which can buy more rescue time for patients and avoid irreversible brain damage. However, it cannot use it as a substitute for treatment. Number 2, what could be the harm if inaccurately diagnose the patient who is not actually suffering from heart attack and stroke? Can I use this method? The answer is there's no harm if the whole procedure is appropriately done. And also, make sure the patient has heart beating. If there's no heart beating, always thinking about CPR first. And question 3, can it save everyone? Well, this method can save most people. So there are papers in China, among 39 stroke patients, 100% were effective or showed a significant effect. And I have used it many times myself. So far I have never seen it ineffective in emergency situation. But there are always exceptions, right? So the truth is CPR cannot save everyone either. So there are no side effects. It is definitely worth trying. And question number 4, are there any other methods to help stroke people and those with myocardial infarctions? The answer is yes, but because most people do not have experience in traditional Chinese medicine, we do not cover it here. If you want to treat those diseases, I still suggest you to go to the professional instead of doing that at home by your own. But of course, to save lives, this method is enough already. So thank you for your attention. If you have any other questions, please leave me a message under this video. I'll always be very glad to help. Have a nice day.